Welcome to Education Open Source. This is a video on renal failure. Please put your comments below or share this video using share button. Renal failure is a decrease or cessation of glomerular filtration. The fluid that enters the capsular space is called glomerular filtrate, and the process is called glomerular filtration. The two forms of renal failure are acute and chronic. In acute renal failure, the kidneys abruptly stop working entirely. Chronic renal failure (CRF) refers to progressive, and usually irreversible, decline in glomerular filtration rate. Causes of acute renal failure include low blood volume, which might be due to hemorrhage, decreased cardiac output, damaged renal tubules, kidney stones, the dyes used to visualize blood vessels in angiograms, non-steroidal anti-inflammatory drugs, and some antibiotics. Renal failure causes a multitude of problems. There is edema due to salt and water retention and acidosis due to inability of the kidneys to excrete acidic substances. In the blood, urea builds up due to impaired renal excretion of metabolic waste products, and potassium level rises, which can lead to cardiac arrest. Often there is anemia and osteomalacia. Chronic renal failure refers to a progressive decline in the glomerular filtration rate, which may result from chronic glomerulonephritis, pyelonephritis, polycystic kidney disease, or traumatic loss of kidney tissue. Polycystic kidney disease is one of the most common inherited disorders. In this, the kidney tubules become riddled with hundreds or thousands of cysts. Cysts are nothing but fluid-filled cavities. Chronic renal failure develops in 3 stages. In the first stage, diminished renal reserve, nephrons are destroyed until about 75% of the functioning nephrons are lost. Once 75% of nephrons are lost, the person enters the second stage, called renal insufficiency, characterized by a decrease in glomerular filtration rate and increased blood levels of nitrogen-containing wastes and creatinine. The final stage, called end-stage renal failure, occurs when about 90% of the nephrons have been lost. People with end-stage renal failure need dialysis therapy and are possible candidates for a kidney transplant operation. This explains the process of kidney transplantation in case of renal failure conditions. People with chronic renal failure are possible candidates for a kidney transplant operation. This video is made by Lavanya for Education Open Source. Thanks for listening.